In Chapter 16, which is entitled A Dialectical Examination of Nursing Art by Johnson, it begins with a statement that nursing is both an art and a science. What is meant by the use of the term nursing art really isn't clear and hasn't been clear in the literature for a long time, because nurses and nursing scholars tend to spend the majority of research time and effort considering issues that contribute to nursing as a body of science. And although numerous descriptions of nursing as an art have been suggested, there's really been little effort to analyze those definitions or engage in dialogue that's been substantive in regarding the nature of nursing as an art. And historically, nursing scholars have done little to address variable positions on how nursing is defined as an art. And that's partially because of the fact that many of them are pursuing their conceptions of nursing as an art in isolation and not sharing them with anybody, or if they are sharing those opinions, no one wants to be confrontational if they have a differing viewpoint. So the book points out that the future of nursing as a profession is going to depend on our ability to identify and resolve particular issues like this in practice. The chapter was based on a dialectical study, and a dialectical approach is when a critical examination and systematic analysis of specific content is done in order to outline and clarify whatever structure of controversy is in question. So it is a process that was developed by Adler in 1958, and the goal of dialectical research is to formulate patterns of agreement or disagreement of the subject matter, to find either similarities or differences among various concepts. So in this particular study, 41 different works from various time periods were examined, and some common themes came out as to how people categorize nursing as an art. And the nursing as an art can be viewed as an intuitive process, a relationship process, a behavioral process, a scientific process, or a moral and ethical process. So if you look in your book on page 174 of Cody, it talks about 5 separate senses of nursing art. I'll read them quick and then we'll get into a little discussion of each one. So the first nursing sense is the nurse's ability to grasp meaning in patient encounters. The second is the nurse's ability to establish a meaningful connection with the patient. The third is nurse's ability to skillfully perform nursing activities. The fourth is the nurse's ability to rationally determine an appropriate course of nursing action. And the fifth is the nurse's ability to morally conduct his or her nursing practice. So let's kind of take a look at each one of those, shall we? The first one, the nurse's ability to grasp a meaning in patient encounters. As I said before, this kind of points to the fact that nursing art could be viewed as an intuitive process. Because nursing care contexts are complex and they're fraught with uncertainty, ambiguity, and indeterminacy. And sometimes patients can't communicate their needs to the nurse because of their situation or because they lack awareness that they have a specific need that needs to be addressed. So nurses need to attach significance to what they see going on in clinical practice in patient situations. And they use their senses to help find meaning in those situations. So sight, taste, smell, and we use deductive reasoning to listen to what the patient's saying. We look at objects in the environment and sounds in the environment. So we're looking at the patient holistically, not just as a being, but as a contextual being that's in constant interaction with the environment. So in order for nurses to grasp a meaning, of a situation, that implies that they're developing a sense of understanding. And when we develop this sense of understanding, we utilize objective facts and our intuition. And intuition is based on a type of aesthetic knowing. And the art of grasping meaning is therefore a perceptual ability that can be improved over time through experience. And Benner's novice to expert works illustrate this concept, because she says that through experiences, nurses learn to focus on what is relevant in a patient situation, and past experiences are going to guide future practices. The second sense that we talked about, ability to establish a meaningful connection with patients. This can be viewed as nursing art being a relational process, all about relationships. And when we talk about making a connection with our patient, that's an attachment or a bond between a nurse and a patient. And making this connection is paramount to the nurse-patient relationship, and it's the foundation for all the care that is going to be accepted or offered. It's important for nurses to express that they actually care, that they're concerned, and nurses need to be authentic. And a nurse that is authentic is one whose actions are consistent with what they should be doing, having an attitude of care and concern. And another important way to connect with our patient is by being truly present in the moment. So trying to avoid those distractions all around us and being genuine and in the moment with our patient. The third sense that was discussed is how the artful nurse skillfully performs nursing activities. So when we consider nursing art from this perspective, it implies that nursing art is a behavioral process. And the word skillfully implies that the nurse completes tasks with proficiency and dexterity. So artful nurses know what needs to be done and they can do it. And as we said before, this implies a behavioral component to the art of nursing, and it focuses on doing something rather than knowing something. And this particular way of looking at nursing as an art implies that nursing can be learned as a skill, and the skills can be acquired over time and improved. The fourth sense that we're going to talk about is how the artful nurse can rationally determine an appropriate course of action based on the meaning grasped in patient encounters. So after we've figured out what is important and what isn't important, this implies that nursing art is a scientific process, because our perception of what needs to be done is based on nursing science. So appropriate courses of action are deliberate. They're not random. We figure out what's going on and how can we best address those needs. And hopefully we've taken a holistic view of the patient scenario when we've grasped that situation. Okay, so praxis is the deliberate and not mindless completion of duties to meet a specific goal. And an example of this, nursing art as a scientific process, would be employing the nursing process to identify a problem and come up with a plan. Okay, and when we say that nursing could be a scientific process, that opens up the discussion that care can be judged according to specific standards, and our standards of care can be judged on whether or not we're meeting patient care outcomes. The last sense that we're going to talk about is how nursing art is based on a practice that is ethical and moral. So a nurse could be technically competent and knowledgeable, but if he or she does not employ the use of morals or ethics into consideration in making patient care decisions, then he or she is not artful. So knowledge and skills aren't the only determinant of having a moral practice. And when one has a moral practice, he or she has the commitment to performing competent care, and that nurse possesses specific moral virtues that are befitting of a nurse. Okay? And the virtues that are befitting of the nurse are virtues of care and concern and wanting to do good for the patient. So beneficence. And the book talks about how nursing practice and nursing actions should be inspired out of love for mankind. So, how do we translate all this into practice? Why is it important? It's important because the identification of distinct concepts of nursing art and what people think about them can facilitate debate and discussion among nurse scholars, which we're expected to be when we graduate from this program. So the authors do recommend that more study is necessary to further define and examine nursing as an art, because it's something that is not well addressed in the nursing literature or agreed upon.